has no father or son.
Truly he is the one, he has no father or son.
Everything in creation was by him begun.
Everything in creation was by him begun.
With his infinite power, anything could be done.
With his infinite power, anything could be done.
Ask Allah for his pardon,
Ask Allah for his pardon,
and you'll enter the garden.
Dr. M.Y.M. Abibu, who is the Chief Consultant Clinical Oncologist and Chief Clinical Coordinator, NSA Youth Cancer Center, also a Senior Lecturer, College of Medicine, University of Lagos.
Lecture today. I've been part of the lectures here before, and I'm happy I'm here again today. I'll be talking about cancer on the rampage. Some years back, when I was in school, we were both in school together. I have a very good friend with me here today. We were taught that cancer is a disease of the developed world, the disease of the white man. Then we used to think we don't have cancer. That was what we were taught. That's in the 90s. But today, we know that one of the biggest problems we have in the health sector is the high incidence of cancer. What is cancer? In Yoruba, we call cancer jejere. I cannot remember the one of Igbo and Hausa anymore. I used to know, but it's jejere, I saw jejere. And from the word jejere, or jejere rather, it is eating. It is eating. Onje. That's exactly, that word explains what cancer is. Cancer is a type of disease that the cells of the body, some of them become abnormal. And there are many factors that can make them abnormal, which we'll discuss later. But the important part of it is that these abnormal cells, they have the ability to continue to multiply faster than normal cells. They are not controlled. Their growth is just continuous. And they have the ability to eat up tissues and organs around them. They also have the ability to spread to distant part of the body. For example, if somebody has bone cancer, it can spread to the lungs, spread to the liver, and it will be eating it. Hence the word jejere, because it's eating other cells of the body. Cancer is a problem today, worldwide, not only in the developed world. It's also a problem in the low and medium income countries, which Nigeria is one of it. As at 2020, Globalcan, which is a UN body, estimated that we have almost 20 million cancer occurring in 2020. 20 million. That's the population of Lagos. Imagine. The population of Lagos, that's the amount of people that had cancer in 2020. And about half of this died in 2020. That's about 10 million people dead from cancer alone. And unlike malaria, typhoid, and other, diseases, cancer is a disease that once you diagnose it, it is very expensive to manage. It's going to take the time of the person. It's going to take the time of the family, that's the caregivers, the family, because it's a prolonged treatment. You can treat cancer for several years, and the cost is prohibitive. Nobody gets diagnosed of cancer and gets away with just $1 million. It will be several millions. By the time you factor in investigation, you factor in the different modes of treatment that we are going to talk about. And then you factor the fact that it's a health burden. Because if anybody is diagnosed of cancer, that totally changes the lifestyle of that person. The person will not be able to go to work as regular as the person should. Hence, will not be able to earn the way he's supposed to earn. the caregivers, the family, close family members, they will have also trauma, psychological trauma, and they may not also be able to go to work the way they should. So, cancer is on the rampage today, everywhere, especially in the low and medium income country in which Nigeria is. And the reason are myriad. There are so many. Many of us know that our great-grandparents, they were either farmers or hunter, or, they, in their lifestyle, they do exercise. If you are a farmer, you do serious exercise because you have to hoe every day, that's exercise. Hunter, you have to run after wildlife. Those who trade, kiri, they have to carry load and trek miles of distance. This is their lifestyle. All this is exercise. But today, many of us, especially us doctors, we are white-collar job. You sit from morning till night. No exercise. Sedentary lifestyle, which is one of the biggest problems that we are having. Biggest challenge, sedentary lifestyle. Even our tons one in shop, jókòó látàárọ̀ títí dalẹ́, ní gbé ọmọ ọ̀dọ̀ kan tó máa sá káàkiri jókòó from morning till night. At home too, we sit down. We don't want to, So I will go back to start. So what is cancer? Cancer is uncontrolled cells that continue to multiply, like I said earlier. And so they are our cells. They are not it's not an infection, it's not infestation, it's our own cell. But some of our cells can just decide to stop responding to regulations of the body, and then they continue to multiply. The cause of abnormality we'll discuss later. So they continue to multiply, and they can spread through the blood, and they can do direct spread to other parts of the body and cause havoc. Tobacco is one of the major causes of malignancy, of cancer. Tobacco is implicated in breast cancer, in lung cancer, and in many other cancers, kidney cancer. So tobacco smoking, also we know in Islam, is not encouraged. So this is one of the most important factors that initiate malignancy. And you can see from statistics, tobacco smoking is responsible for about 1/3 of all cancer. Smoking tobacco is one. Smoking exhaust from the car is another. Many of us know that most of the time these days we are in traffic, and when you are in traffic, you are smoking carbon monoxide from other cars. Then some of us are living close to large factories. We are smoking exhaust from those factories. And most of us at night, when you sleep, NEPA take light. Your friend in the east, in the north, your neighbors, all of them put on their generator. You are smoking exhaust from the generator. So smoking of combustion, of incomplete combustion, is one of the greatest cause of cancer. Diet is another. In the past, we take our own diet. We take eba, fufu, iresi, and all that. But today, it is spaghetti, it is noodle, it is burger for those who are in a hurry, because of time, we are tending towards taking fast food. And unfortunately, fast food it causes malignancy, it causes cancer. And fast food is likely to shorten our life. If we are going by fast food, we will live on this earth very fast. Cancer takes away life. Then obesity. Obesity is related somewhat to activity. Like I said, we are now living a sedentary lifestyle. Most of us will sit down morning till night. If you are a doctor, for example, or whatever, we like white collar job. Unlike our parents that were farmers, that were hunters, that were traders, that had to do exercise by the nature of their job. Today, even if you sit at home, you don't want to put on the television. You use remote control. You can't stand up to, put on the television. If you want to wash your clothes, you use washing machine. No exercise to wash the clothes anymore. Even to bath, some of us will use jacuzzi. Just lie down there and the thing will be bathing for you, If we get to some extent, we will have machine that will be feeding us when we want to eat. But this is not the best. We are supposed to do exercise in our day-to-day activity. Otherwise, we'll be calling malignancy. Then infection. Infection is also very important as a cause of cancer. One of the greatest infection that leads to cancer is HIV. Anything that reduces our immunity. HIV is human immunodeficiency virus. It causes AIDS. AIDS is acquired immune deficiency syndrome, which occurs from a viral infection. There are many other types of infection that can cause cancer. For example, there are some infections that can cause bladder cancer. There are infections that causes lymphoma, like Burkitt lymphoma. Even malaria, that's mosquito Kale malaria, that causes some type of cancer. So infection, although it just ranks about 7% of what we do. Inactivity is related to obesity. It's also related to other. Then alcohol. Alcohol is also one of the important factors for causing cancer. Alcohol is a sister to cigarette. If you smoke, your chances of having cancer goes up very high. If you take alcohol, it goes up very high. But tó bá ṣe méjèèjì, ó dàbí ìgbà tí wọ́n bá da petrol tó ń fa tó lè gbéná tó wá ṣáná sí. The effect is synergistic. Ó máa multiply ara wọn ni, kò ń ṣe addition. If smoking increases the risk by say 4% or 4 times, fourfold, I meant to say, and alcohol increases it by twofold, the person that is taking the two will have the risk increased to 8-fold, not 6-fold. Because it's a multiplication factor, not addition. Then exposure to radiation. Cancer, but cancer of the skin. We in this part of the world, we have melanin. That's why we are black. God has protected us from cancer formation of the sun. Ṣùgbọ́n nínú wa aláwọn ààfin albinos. You will see that most albinos, as they are growing older, they start having what we call freckles, skin lesions. Most often than not, this can result to skin cancer. That's why if you have an albino child, you must always dress the child up to cover the hand, the legs, and wear face cap when it's still a child. When it's an adult, it's still encouraged, cover around, but the risk reduces. Ọmọdé is not as tough as an adult. So the children are more vulnerable. So also the white people, cancer of the skin is one of the commonest in the West. Because we have melanin. But their own melanin is not like our own. So they have a lot of skin cancer. Occupational hazard for people who works where there is radiation or who works with chemical, because exposure to chemical only for cancer. Our chemicals stand low. In fact, nínú oúnjẹ tá ń jẹ nísìn, chemicals ti pọ̀ nínú wọn. Most of us know that preserved food là ń jẹ, canned food. You take baked beans, you take steamed tomato. We use preserved food. Sardine and all this. All these food are preserved. All the chemical preserved. Teba se ẹja kẹgbẹ sínú can, ó máa bàjẹ́ within a few days. But if it is preserved with chemical, then it can last long. So all these preserved food that we eat, that we import, that are foreign food, they all most of the time contain chemicals. And these chemicals can also serve as chemical irritants. What they irritate the cells or in irritating the skin, they will result to cancer. So, what are the common cancers we have? Today, the commonest cancer is breast cancer. Breast cancer has overtaken lung cancer as the most common cancer in the world. And in Nigeria, breast cancer is up to 30% of all cancers that we see. That's breast cancer. And that accounts to over 100,000 cancer diagnosed every year in Nigeria. Just breast cancer alone. We normally say female breast cancer. But males can also have breast cancer. Only that 99% of people who have breast cancer are female. But we have male breast cancer and we are treating them. I have a patient that I saw even last week that is a male with breast cancer. However, in male, prostate cancer is the commonest. Like you can see, prostate cancer is 1 out of every 4 men that have cancer. And what is the cause of prostate cancer? Aging. Tọkùnrin bá ti ń dàgbà sí, tó bá ti ń dàgbà, tó bá ti wọ 40, tó ti ń wọ 50, ó ti yẹ kó lọ máa ṣe n tá ń pè ní PSA. PSA is prostate specific antigen. Ẹ̀jẹ̀ láti ń jamakọ̀ gbẹ̀jẹ̀ ẹni náà ni once in a year or once in 2 years, because tẹ́ni ẹ bá ní problem pẹ̀lú prostate, PSA a máa lọ sókè. So a lè tètè mú torí wọ́n ní a stitch in time save 9. Tá a bá mú ní level tó bá yẹ pé wà early, ó máa ń ṣe treat. Ẹni yẹn kò tiẹ̀ ní go through most of the modalities of radiotherapy. Treatment máa short, then prognosis or outcome ó máa wà okay, a lè cure. But tó bá ti pẹ́, tó bá ti fẹ̀ lójú, ó máa difficult o. Tó bá ti spread, kò kì í usually ṣe cure o. A máa ṣe n tá à ń pè ní palliative treatment, which means a máa pa pain, a máa try láti stop ẹ̀ kó máa progress fast. Ṣùgbọ́n cure kò sí bẹ́ẹ̀ mọ́. So it's very important for us men to be doing PSA check, especially when you are above 40, or if there is a family history, then we have to do it and even more regularly. Lung cancer ní àgbáyé ó common, kò fi bẹ́ẹ̀ common ní ọ̀dọ̀ wa, ṣùgbọ́n kò ṣe pé kò sí o, a ní but kò common. A kì í smoke bí àwọn òyìnbó àtàwọn èèyàn mìíràn, so a ní lung cancer tó wọn. Then colon cancer ìyẹn ò pọ̀ lọ́dọ̀ wa tẹ́lẹ̀tẹ́lẹ̀. Colon ibi tí ilé oúnjẹ ibi tó oúnjẹ ń gbà ìyẹn náà ti ń wá sókè nísìn. Tẹ́ bá rí ẹ rí pé 10% of people with cancer, of men with cancer is colon cancer. Ó jù yẹn lọ níbí báyìí o, ó jù 10% lọ ní Nàìjíríà. Ní Nàìjíríà ó máa tó 15% because colon cancer ti ń high gan, a ti ń jẹ oúnjẹ àwọn òyìnbó, so a ti ń ní àìsàn wọn. Jẹ tiwa mọ́ bí bó ṣe yẹ ká ṣe jẹ́. So you eat preserved food, you eat foreign food, high residue diet, then you get the sickness of those who eat it. And that's what we are having. Then bladder cancer náà ó high, especially àwọn tó gbé ní etí omi. Torí ó láwọn àrùn kan tó máa wà létí omi nígbà míì tó yẹ pé téèyàn bá mu omi ibẹ̀ ó máa lọ fa kíni bladder cancer. Ẹni yẹn á bẹ̀rẹ̀ sí ń tọ̀tọ̀ ẹ̀jẹ̀. Mortality. Báwo làwọn èèyàn ṣe ń kú? Tẹ́ bá rí ẹ rí pé lung cancer òun ló pọ̀jù láyé tó ń cause mortality, but lọ́dọ̀ tiwa prostate cancer ní fọ́kùnrin, then colon cancer náà ó wà very high lọ́dọ̀ tiwa fún ọkùnrin. This is just a summary and overview of how it is for men, mortality of cancer. For women, worldwide, breast cancer òun ló pọ̀jù. Mo ṣe sọ ní àgbáyé about 30%. Breast cancer is very high worldwide. It's the commonest cancer worldwide now. And then also in Nigeria, breast cancer is even more common than prostate cancer. The single most common cancer in Nigeria is breast cancer. In Nigeria, it accounts for about 30%, but worldwide, it accounts for about 26%. Like I said earlier, in Nigeria, breast cancer alone accounts for almost 100,000 a year. That's 100,000 of people having. If you look at our football field, I'm not sure National Stadium can take 100,000, but that's what we have. And breast cancer is followed in this part of the world by cervical cancer. Cervical cancer is the disease of the cervix. The cervix is the neck of the womb. We marry a bit earlier in some part of this country, and because of that, and also, more importantly, multiple sexual partners to aid the contact of human papilloma virus are the risk factor for cervical cancer. Breast cancer has many risk factors from family history, which about 20% is linked to genetic factors. Also, the diet, fatty food are also predisposed to, breast cancer. Apart from fatty food predisposing to breast cancer, lack of exercise sedentary lifestyle. All these are predisposed to breast cancer. I will go back to talk again more on breast cancer. Mortality. Breast cancer still leads mortality. Breast cancer is the highest cause of death. But if you put both male and female together, breast cancer still lead the cost of cancer death in this part of the world. It may be lungs outside the world, but here it is breast cancer. And colorectal cancer, like I said, which is the cancer of the colon and rectum, are also high in the cause of death in our own part of the world. So all that is overview. Now I'm going to the real, cancer is a public health problem. You can see that in some other climes, they are doing a lot to curb cancer. And one of the ways you can curb the problem of cancer is putting the treatment of cancer in insurance. So those of us here that have the connection, we have to push the government to see that treatment of cancer is put in insurance, because the treatment is prohibitively costly, and it is difficult for any individual, especially in this part of the world where we are not really earning much, to fund the treatment of cancer. It can best be funded with insurance, and perhaps if we are funding it with insurance, people will be able to turn up early so that if they can start treatment early and we can have more cure. Many people don't come up because they can't afford to pay for the treatment, and at the end of the day, they will have to sell houses, come on air to come and beg for money, and at that time, when the money comes, the disease is already very advanced, and the money does not do anything. So we need to put it in insurance. And cancer can affect everybody. We are not praying for that. But what I'm just saying is that we all can have cancer. But by God's inshallah, we will not. But cancer does not respect anybody. Whether you are an oncologist, whether you are a doctor, engineer, you are a clergyman, you are light-skinned, you are dark-skinned, you are rich, you are poor, you are not immune to cancer. Nobody is immune to cancer. We see cancer in newborn babies. We give birth to them, you see cancer. Retinoblastoma is one of the cancer that you see in newborn baby. So people at times say, why me? What have I done wrong? What will you say the baby has done wrong? Baby has not done anything wrong. So cancer is not necessarily by what you do wrong. Although we can do some things to reduce the risk of cancer, but we cannot completely eliminate it. Cancer can come to anybody. So that's one thing about cancer. Cancer today is the commonest cause of death, especially worldwide. It's second in Europe to only heart disease, and in this part of the world to infection and infestation. It's like I said, the third leading cause of death in many other low and medium African countries. Incidence is on the rise. It used to be said, in 2008, it used to be 12 million people that had cancer. I'm sorry, I think what I actually brought out is not the version. I've corrected this, but at times you have error. What we have today, like I said, is almost 20 million incidents in 2020. What we have here is in 2008. In 2020, it has risen from 12 to 20. You can see that it's on the rise. The incidence is on the rise. And unfortunately, the rise is contributed majorly by the low and medium income country. The reason is that the high income country, they have put in place procedures to curb cancer. They have many, screening methods that they use. They have vaccination, and their own cancer is coming down. Unfortunately, we don't have strong programs. So we are the one contributing more to the rise of cancer incidence. By 2020, it's now about 20 million, which is population of Lagos, population of Kano. That's the number of people that are having cancer just in 1 year now. And I'm sure 2024, it will be more than but it will be more than 20 million. We don't have the estimate yet, but we know it's an upward trajectory. So we know by now it's more than 20 million that we diagnose in a year. Lung cancer is the commonest before, but now breast cancer has overtaken. Lung cancer in 2020 was 19 million. Breast cancer was 19.7 million. So breast cancer is now the most common. And colorectal cancer, stomach cancer are all on the rise. You can see just breast, female lung cancer, colorectal, and stomach, they make up 40% of all cancer as at that time. So just a few cancer is responsible for the whole gamut of cancer that we have. So these are the list of common cancer. We have lung cancer, breast cancer, prostate cancer, colorectal cancer. These are the list of common cancer. If you add prostate cancer to it that I did not add, it becomes 50% of all cancer. We must know that cancer can develop from any part of the body. It's not limited to organ. Cancer can come from bone, it can come from blood, it can come from beneath the nail, it can come from the gum, it can come from eye, it can come from brain, it can come from anywhere. Any part of the body that has blood supply can develop cancer. But 50% of cancer only comes from this part of the body. So what are the risks? I'll go more into the risks. From the overview, I mentioned irritants. So what are the common irritants that, that causes cancer? It could be chemical or environmental, irritants. Asbestos exposure. You can see that before we used to use asbestos sheet, roof sheet, but today we are jettisoning it because it causes pneumoconiosis, it causes lung cancer, and other cancer. Asbestos is also used in fridge before. It's used in plane. It's used in many other products. But today we are ruling it out. Nobody uses asbestos in the developed world for any manufacturing anymore. Then agricultural fertilizer, NPK. NPK has been queried by many specialists. That's the fertilizer we put. That's why you see that organic fertilizers like dung from sheep, they are cheaper. They are, we can use them too, but NPK fertilizer has a higher yield. If we want to cut corners to use chemical fertilizer, we also expose ourselves to cancer. Then industrial waste. Industrial waste, we know that in mega cities, big cities like Lagos, usually we have factories. These factories, they help us to have mass production. But there's nothing that you do that has positive that does not have corresponding negative. So the negative aspect of industry is that they have waste that can be problematic, that can result in malignancy or cancer. Formaldehyde is also a type of chemical. Most of us here, we are all wearing clothes. Our clothes are in colors. And these colors are, is dye. Everything you have here that have color has dye in it. Dye it makes things beautiful, but it can also predispose to cancer. Paint, we know that we have our house painted, our cars painted, they also predispose to cancer. So what is there is that we still have to have all those things, but we have to use them appropriately. We have to be responsible in the way we use them. Not that we will not use them. Food, like I said earlier, high residue diets. High residue diets are diets that does not have fiber. They are not our own diet. They are diet like burger, like noodle, like spaghettis. You see that when you take them, you don't go to toilet for long. Unlike if you take our own gari, cassava flakes, you go to toilet. If you take yam, you go to toilet. But if you take all those fast food, you don't easily go to toilet. So they predispose to colon cancer. We have aflatoxin, which is a kind of fungus that if you do not preserve your grains very well, like granite, you can have them. They are not easily destroyed by fire, and they can also cause cancer. We have preservatives that we put in canned food, juice, and all those all these things, all this food that you can buy and keep for several months without putting it in freezer is because they have chemicals to preserve them. Those chemicals will preserve them for you, but will also hurt you if you do not take it appropriately. We have artificial sweeteners. Some people will say they don't like sugar. They don't like the normal sugar. They want artificial. You just have a drop like this, and the thing is tasting as if you put 5 sugars. Yes, it will also, it's a chemical, that's why it's doing like that. And if you don't use it wisely, it will predispose you. The water we drink, we use fluorine to purify it. When you have a chemical that can kill germs, if you add more than it needs to kill germs, it will also kill your own cells, or it will cause problem for you. So, but we still have to do fluoridation because you don't want germs to kill you. So it's balanced. Like I said also, some people, you hear that the father had prostate cancer, the uncle had prostate cancer, the brother had prostate cancer. Such a person, if you check well, the gene, the family has gene that causes that prostate cancer. It could be breast cancer. The father, the granny, then they have that gene which can be checked, which causes cancer. The common genes that runs in family are BRCA1 gene and BRCA2 gene, which usually may cause breast cancer, prostate cancer, and some other cancers. Then we have familiar genes too, FAP, familial adenomatous polyposis for colon cancer. Then we have P53. This P53 is the one that is implicated in most cancers. About 50% of all cancers, we have P53. P53 is a gene that controls our immunity. We all produce cancer cells. Everybody produces cancer cells. But we have the gene to control the cells that pick them off. So it's just like you have a gate man that protects you. Once your gate man is not doing the job, robbers will come in. So if there's a problem with P53, the cancer cell you produce, they will not be taken off. And they'll continue to multiply, and this will result in cancer. So we all produce cancer cells, but we have mechanism to take them away normally. Then infection. Kaposi sarcoma is one of the cancer that was first associated with HIV. HIV is a type of virus that reduces our ability to fight, and it reduces our ability to ward off cancer cells. And most people that had it in those days, they also had a type of cancer of the skin, which we call Kaposi sarcoma. But we later found out that even other cancers can come in HIV patients. For example, cervical cancer is very common. There is what we call sarcoma, cancer of the soft tissue, brain cancer. All of them were now being associated with HIV. Even cancer of the sclera. If I see a patient today come and says tumor cell of the sclera, that is the eye. The first thing I want to know is does this person have HIV? Because it's almost like that. Almost all the patients we have with sclera, squamous cell carcinoma, they have cancer, they have HIV. Then I talked about a worm. The worm is called schistosoma, usually found in stream. You will see that a few people that live along the stream, when they pass urine, they pass blood in urine, because this worm can cause bladder cancer, and this results in bloody urination. Exposure to ionizing radiation. Many of us will know that when you want to do chest X-ray or CT scan, they tell you to give a gap of 6 months in between. The reason why they are telling you to give a gap in between is because ionizing radiation, which is X-ray, which also can be used as a form of CT scan or other ionizing radiation, they can cause damage to our cells, and this damage can result in cancer. The sun has ultraviolet radiation, and the ultraviolet radiation usually we call basal cell, especially for albino and light-skinned people. You will see that in the West, skin cancer is very common because they don't have melanin, which we have, that protect us against the ultraviolet radiation. But now today we have masks. We have masks everywhere. We have television everywhere. We have radio centers everywhere. All these were not, in 20 years back, 30 years back, we didn't have them. Every one of us has GSM. All these are run by radiation. And radiation is a spectrum. We have the spectrum that is very bad. We have the spectrum that is not bad. But what we are using run in between this spectrum. So as we use more radiation, we are more predisposed to cancer formation. Tobacco, I already said tobacco smoking. When you smoke cigarette, there is something called tar in it. Unfortunately, when you are smoking, everybody around you is also smoking. They are secondary smokers. They are passive smokers. But you are the main smoker. So you are not only causing problem for yourself, you cause problem for people close to you. When you travel and when you go to some places, you see they put no smoking, no smoking. Those places, most of the time, they give you a place where you can smoke. So that if you want to cause problem for yourself, you can cause. But don't cause problem for other people. Cigarette smoking can cause lung cancer, can cause kidney cancer, can cause breast cancer, can cause many cancers, head and neck, nasopharyngeal tumors, tongue tumor, There are so many cancers that is associated with cigarette smoking. So it's something we need to run away from. Alcohol is the sister of cigarette. You will see that most of the time, not all the time, people that smoke, they also take alcohol. People that take alcohol, they also smoke. So these sisters, they not only increase individually the risk of having cancer, but when you take the two, they multiply the risk. Like I said earlier, if one is 5-fold, the other one is 6-fold, when you take the two, the risk is not 11, the risk is 30. Because one will multiply the effect of the other. It's just like petrol and fire. When you put them together, they multiply the effect. Then, you see, as we are developing, then our medical techniques also develop. And in self-preservation, we start changing our organs. If we know one of I won't mention him, but we know one of our very eminent politicians that was caught in Britain because they want to change the organ of the daughter, the kidney of the daughter. We can now change, organs. However, the body, it does not necessarily, it's not designed to take what is not his. So, for you to change organ, you have to suppress immunity. And in suppressing immunity, you are also giving cancer cells a competitive advantage. Because when you suppress immunity, the cancer cells, they can get upper hand and they can come up. So in organ transplant, patients with organ transplant can also come up with cancer. And I've treated a few patients that had organ transplant. 5-10 years later, they have cancer. So we know that the organ transplant, genetics. There are pathophysiology of causing cancer. There are many pathophysiology. That's many ways cancer can be caused. I will not bore you with grammar. I will just break it down and try to, make you understand. They are part of the body, part of the cells that when you initiate them, when you trigger them, they will increase growth. And there are also other parts of the body that can suppress growth. So there is a balance. Any change in this balance can trigger, especially a change that reduces the ability to suppress growth or a change that increases the ability to initiate growth. It can lead to cancer because cancer usually is abnormal cells that are not suppressed, that continue to grow. So I won't talk about gene application, mutation. Mutation is the change itself. The abnormal change that just comes on its mutation. The translocation, all this, I won't want to bore you with it. This is just a graphical representation. Then, management. There's no way we'll talk about cancer without talking about management. Because the management itself is what is the real problem. If we can manage well, probably we'll be able to reduce the mortality and morbidity of cancer. We can't manage well most of the time because of the cost and because there are no set down rules for managing. In fact, most of our patients would have gone around either to spiritual houses because in their own belief, cancer is spiritual attack, or whether alternative therapy because they feel that the real orthodox therapy is dangerous. What I always tell my patients, is that when it comes to cancer treatment, if you follow alternative therapy, you are going to result in alternate destination. You can't follow alternative therapy in cancer treatment and get to the right destination. You always get to the alternative destination, a fatal destination. So the earlier you come for orthodox treatment, the better. So how do we do it in the normal setting, the right setting? In the right setting, the treatment of cancer is done by multiple specialists, not one person. The decisions is taken by multiple. So you have a surgeon, you have a gynecology, depending on what you are treating. You have a cancer nurse, you have a pathologist, oncology nurse, because the pathologist is the one that will diagnose that this thing is actually cancer when you take the sample to him. So, and he will tell you the type of cancer it is. Is it a fast-growing cancer? He will tell you immunohistochemistry. Is it sensitive to this? Is it sensitive to that? Then a surgeon is likely the person that will first take the sample and is the one that will remove that part of the body if it need be. Then we have oncologists, which I am, and is the one that will deliver other forms of treatment apart from surgery. And when you put many good heads together, the decision is usually not beaten. It's usually the best decision. That's what we do in standard setting. So you must take histology, investigations, you must take biopsy to confirm that it's cancer. Then you do some investigations to see how far it has spread. Radiology like CT scan and all that. Then you check the blood to see if the person can actually withstand the treatment, or as the cancer dig deep into the bone marrow and the person is no longer fit, because cancer at times can behave as if it's sucking the patient's blood. See the person paper white and all that. So modes, there are 5 major ways cancer can be treated. However, these major ways, we do it in combination, not that you do one alone. You do it in combination. The only time you can do one alone, if the person presents very early, and that's why I said we must do screening, because the only way you can detect it early is when you screen. Because when it's early, it doesn't cause any problem. Cancer does not cause pain, doesn't cause you any problem when it's early, but that's the time it's good to treat it. Once it starts causing pain, it's already spreading. So major ways are surgery, radiotherapy, chemotherapy, hormonal therapy, and targeted therapy. That targeted therapy is a new therapy, and it's so costly that a cost of targeted therapy may be up to 2 million, and you may have to take 18 courses. So it's terribly expensive, but it's less toxic to the patient, only toxic to the pocket of the patient. So we have other modes that we can join with those major ones, like control of pain. If a patient has come in an advanced stage, the patient will always have pain, so you just have to control the pain. You have to cancel, because most people believe that if you give treatment, this thing will be cured. But unfortunately, unlike many other conditions, cancer, you may have to live with it. So you need to cancel the patient, you need to cancel the relative, you need to cancel everybody that is around the patient, so that they understand what this patient is going through, and the patient also understand what is happening, so that I won't think that it's one old woman or one old man that is fought in the market that is causing the problem. Then you also tell the patient the side effects of the treatment. So like I said earlier, surgery, you can take biopsy, that's just a sample, and you can remove that segment of the body. For example, if we are sure that the thing is limited to one hand, it has not spread, you can as well remove the hand so that it will not kill the patient. And there are, most of the time, it's breast that we remove. We call it mastectomy. When you are sure it is still within the breast, it has not spread, you just remove the breast and the person live on. We give artificial breast, what we call prosthesis, and nobody will know except the person she wants to know. Then radiotherapy is use of ionizing radiation, like the X-ray, like the gamma ray, like electron beams. These are radiation that carry energy. So they are able to burn the cancer cells. There are ways you use radiation to burn cancer cells by giving a dose that will not harm normal cells, but that will harm cancer cells. Cancer cells are more susceptible to ionizing radiation, so you can burn them more than the normal cells. These are the people that first discovered ionizing radiation. Perekure, Henebekwe. They got awards for the use of radiation. But they were all killed by radiation, because as at that time radiation has not been studied. So they discovered it and they used it to treat They use it. One of them just found that it put down a radioactive isotope, and the film he kept in the cupboard, was showing the ring of the wife. And he investigated further. He saw that this isotope can burn. It can, give you the internal structure of, that's how radiology and radiotherapy started. And they got Nobel Prize for this, for discovery of ionizing radiation. They lived by it. They used it for a lot of things, but they also died by it. So radiotherapy can be done in two ways. There is what we call teletherapy. There is what we call brachytherapy. Tele is the use where you can use to treat large volume, brachy to treat small volume. Let me, sorry. I know I have a little time. That's why I'm in a hurry. So usually you can use radiotherapy for prostate cancer and many other cancers. Chemotherapy is what many people fears, because when you watch films, you see chemotherapy, the hair of the person that has chemotherapy fall off. So many people fear chemotherapy, but it's not everybody that have the side effect. Chemotherapy is using some drugs which can kill cancer cells. You introduce it into the vein, or the patient takes it orally, and we do it periodically. But the side effect that comes with it, we also give drugs to prevent or to minimize them. We don't give chemotherapy alone. You give it along with drugs to suppress the side effects. We have different types of chemotherapy, so I won't go into details of the different types of chemotherapy. We also have targeted therapy. Targeted therapy are more modern. They are not chemotherapy. They don't have the side effects of chemotherapy. They are targeted. That means they target the cancer. They will go straight to the cancer cells. But because they are very new, and because it takes a lot to produce them, they are very expensive. They are not toxic to the patient. They are only toxic to the pocket of the patient. It can cost millions to use targeted therapy. We also have hormonal therapy. We have found out that the two most common cancers, breast in female, prostate in male, both of them, they have hormonal support. The male hormone, which is called testosterone, drives the male cancer, while the female hormone, estrogen, drives the female cancer. So you can actually block these hormones. To block the male hormone in prostate cancer, you can remove the organ that produces it. The main organ is the testis. If you remove the testis, you are starving the male, and it actually works. You see some patients, the prostate cancer has spread to the spine. Immediately you remove the testis, the patient starts walking, because that serves the cells of testosterone. Also in females, you can remove the ovary. But this you can also do by introducing drugs that will block the effect of production of testosterone, or block the production of estrogen, which is what is commonly done. Immunotherapy, I already mentioned immunotherapy. So I will just round up with just a small advice. Now, like I said, to actually cure cancer, screening is what we need to do, and that's also to reduce the incidence. And screening for females, you have mammogram or mammography, you have breast ultrasound scan, and even you have cheaper ones, breast self-examination. I don't have time, I would have projected it. There's breast self-examination that you can do the examination yourself. It doesn't cost you anything. And for males, there is PSA, which you must do, because the truth is that when you diagnose it early, it costs you a fraction of what it will cost you when you diagnose it late. And also, that fraction is more purposeful, because it will result in cure. When you diagnose it late, you spend tons of millions, but you don't cure. You only suppress or palliate. So my message is that we must do screening. Jazakumullah khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum salam wa rahmatullahi wa barakatuh. Takbir. Allahu Akbar.